So I'm discussing EYP-1901, which is a tyrosine kinase, and tyrosine kinases are potent pan-VEGF inhibitors. And what we're discussing is the DAVIO 2 phase 2 trial data and really looking at how EYP-1901 helped decrease treatment burden in patients with wet macular degeneration. Sure, that's a great question. And it really has to do with how clinical trials are designed. They have to be designed in a way that follows current FDA labeling of a drug. And so, because aflibercept 2 milligrams is on label as having to be given or not having to be given, but on label as being given every 8 weeks, the trial design is therefore put forth similarly. Sure. Another great, excellent question. I think when we look at where we want new therapies in wet macular degeneration, one of the areas of interest and also need is really in decreasing treatment burden, getting more durable therapies out there. And so, looking at phase 1 and 2 data, some of the patients that are going to be most excited to enroll in clinical trials, some of the um, and we're going to want to enroll patients in clinical trials as patients that have a high burden of treatment. And so the patients enrolled in this trial really needed quite a few anti-VEGF injections. They were receiving on average 10 anti-VEGF injections in the year prior to trial. And this is probably the patient population that we're going to see, TKIs used in first. And so may most closely mirror the first group of patients that we use this in real world practice. That being said, in the phase 3 trial, which is now underway, treatment naive patients will be enrolled. Yeah, I think it's things like TKIs are going to be a game changer for us. Our patients with wet macular degeneration in particular are elderly. They have trouble getting to appointments. They oftentimes need somebody to accompany them to appointments, which means somebody else has to take a day off of work to bring them in. And putting in something that is sustained release and can really give patients more durability, I think is going to really change the burden of coming in for regular visits, coming in for regular injections. I think the thing that we will have to figure out is how often are we going to be monitoring these patients? Is home OCT going to become something that we more regularly use in our practice to monitor how these patients are doing at home, and therefore, again, not only decreasing treatment burden but visit burden as well. And so I think it still is yet to be figured out how we truly incorporate more durable therapies into our everyday practice. Yeah, I think that we're learning more and more about OCT biomarkers that will help us personalize care for our patients. I think that, you know, we still are very early in what we know about TKIs and this particular drug in general. And I think longer term data is really what we need to know when these patients truly need to be redosed or supplemented. And I think only time will help us give those answers. Yeah, I think that's a great question. I think, when gene therapy, we're hoping that that's maybe a one and done process. With TKIs, EYP 1901, which is the data I presented, is made to last up to or could last potentially longer than 6 months. But the idea is that it would potentially need to be redosed at some point. And I think that TKIs may have a role as an adjunct as well in some patients who may not be responding to current treatment, and also potentially a role in increasing durability of treatments. Yeah, I think initially it will likely be used in our patients who have a high treatment burden, those patients that are requiring frequent anti-VEGF injections. We know patients need frequent anti-VEGF injections for better visual outcomes, and giving them something that will give them constant VEGF inhibition over a longer time period will decrease treatment burden for those patients. And so I think We'll initially use it in our patients that are requiring very frequent anti-VEGF injections as a potential second-line treatment option. I do also think in some patients it may also be an adjunctive treatment to increase durability of current options.